In most wealthy countries, you can go to the hospital, get treated, and walk out without worrying about a bill. In the US, you might walk out with a bill that's bigger than your mortgage, or your car, or your college tuition. So why is America, one of the richest nations in history, the only major country without universal health care? The answer is a story of missed chances, powerful interests, and a culture that resists change. Let's break it down. America has been debating national health insurance for over a century. The first major push came in the early 1900s, when progressives tried to introduce compulsory insurance like Germany and the UK. Back then, even the American Medical Association, or AMA, was somewhat supportive. But by the time World War I ended, the AMA and private insurers were fiercely opposed. They labeled it socialized medicine and helped kill the effort. This pattern would repeat again and again. Britain created its National Health Service after World War II. Canada followed with a universal system. Here in the US, President Harry Truman tried to do something similar, a national health insurance plan, paid for through taxes and run by the federal government. But once again, the AMA launched a massive campaign against it, branding the idea socialized medicine, which in the early Cold War was political kryptonite. But there was another factor. Southern segregationist politicians, worried about integrating hospitals, joined forces against the plan, making it nearly impossible to build a winning coalition in Congress. Add to that the fact that many Americans were already getting insurance through their jobs and there wasn't enough public pressure. Truman's plan never even made it to a vote. So how did job-based health insurance become the norm in the first place? During World War II, the government froze wages to control inflation. Companies couldn't raise pay, so they offered health insurance to attract workers. Employees loved this benefit. After the war, the IRS made these health benefits tax-free for employers, giving companies a big incentive to keep the system going. By the 1950s, if you had a good job, you probably had coverage. If you didn't, tough luck. Employer coverage became the dominant model, making later reforms much harder because millions of Americans now feared losing what they had. The next breakthrough came in the 1960s. President Lyndon Johnson signed Medicare for seniors and Medicaid for low-income people and those with disabilities into law. This was a huge step, but it was limited. These programs only covered certain groups, not everyone. In the early 1970s, something surprising happened. President Nixon pushed for the Comprehensive Health Insurance Plan, which would have required employers to provide insurance for all workers and expanded federal programs for everyone else. It was a plan that could have brought the U.S. close to universal coverage. But Congress was divided. Democrats wanted a bigger, single-payer style plan. Republicans opposed new mandates. The battle dragged on, then fizzled out, and another window for reform closed. Race and region kept shaping reform. Many Southern politicians continued to resist any federal programs that might require integration or change local control. As a result, U.S. reforms often focused on politically powerful or sympathetic groups, like the elderly or children, rather than everyone as a whole. Fast forward to the 1990s. President Bill Clinton and First Lady Hillary Clinton introduced the Health Security Act, a plan to cover all Americans using regional health alliances to negotiate prices. Industry groups, insurance companies, hospitals, and business lobbies launched an aggressive PR war against the plan, including the famous Harry and Louise TV ads that made the proposal look confusing, expensive, and risky. Public support collapsed almost overnight, and the plan never made it to a vote. Jump ahead to 2010. President Barack Obama signs the Affordable Care Act, or Obamacare. This is the biggest expansion of health coverage in decades. The ACA bans insurers from denying you for pre-existing conditions, sets up online marketplaces, and encourages states to expand Medicaid. Millions more Americans gain coverage, and the uninsured rate drops by half. But the law is still far from universal. Private insurance companies remain at the center. Many states refuse to expand Medicaid, leaving millions of people in a coverage gap. Healthcare costs, premiums, deductibles, out-of-pocket remain high for many. And massive political backlash follows, further polarizing the debate. Today, the U.S. spends over $4.5 trillion a year on healthcare, more than any other country in the world and more than 20% of our GDP. Yet millions remain uninsured and even more are underinsured. Why is it so hard to change? First, there's money. The healthcare industry, insurance companies, drug makers, hospitals, spends more on lobbying than any other sector in Washington. They pour hundreds of millions of dollars a year into keeping things the way they are. Second, there's American culture itself. Many Americans value individual responsibility and distrust big government solutions. Even if people like the idea of universal coverage, they worry about higher taxes or longer waits for care. Third, it's an entrenched system. The employer-based model, plus coverage for seniors, children, and low-income Americans, means most people have some stake in the current system, making sweeping changes politically risky. Lastly, public opinion is divided. A solid majority now supports expanding access, but views sharply differ by party. Most Americans agree insurance companies have too much power, but there's little consensus on how, or even if, to fix the system. So why doesn't America have universal health care? Because at every turning point, from the progressives to Truman to Nixon to the Clintons, the moment slipped away. Sometimes it was politics, sometimes it was money, sometimes it was race, culture, or just timing. And once a system this big gets built, changing it is harder than building it from scratch. Will universal healthcare ever happen here? That's up to the voters. What do you think? Let me know in the comments. And don't forget to like and subscribe for more videos from this channel, What's the Why?